Hey everyone, Dr. F.J. Schofield, West Bend, Wisconsin, chiropractor. Got a cool adjusting video here for you and a great story. If you know someone who could benefit and help, please share it. If you got value or you enjoyed it, please hit the subscribe button. And remember, take charge of your health. All right, Mike, so what's going on?
I'm having some pain in my lower back and down to my knee.
When did it start?
Friday afternoonish.
Okay. No reason for it?
Nothing that I can think of.
All right, let's check your posture standing and see how it looks. Yeah, you're off. You're leaning to the left. Okay, let's have you come lay on your back. Yeah, left leg's contracted. It's all the same. You just went out of alignment for some reason. You lean it to the left leg short. All right, let's have you sit up facing that way. And come and lay on your. What? Before we do that, actually, is there any movements that really aggravate it?
Like going anywhere to this side, I guess.
Just leaning to the right.
Yeah.
Right.
Yeah, right in there.
Okay. Come lay on your left side. Come on up. Now lean that same way, see if it feels any different.
It feels a lot better.
Awesome. Let's check you standing, see if it's probably means you're way more centered. What a difference. So much better. Good. And come lay on your back for me. Yeah, legs are balanced. You can just, such a difference. All right, now we're just gonna release a little tension. Excuse me. There we go. And then go face down. Lift your right leg straight up and down, and the left. One easier than the other, Mike?
The left was actually a little easier.
Where do you feel it when you lift the right?
Right up in here, when I was all the way up.
In the hamstring and all the way
Yeah.
up? Okay. This usually means your right hip's rolled forward. Lay on your side, facing me. Good, a little more, a little more. Good. And face down, see if we got it. And lift the right and the left. How'd it feel that time?
A little bit better.
Still pulling in the hamstring?
Just a little.
Okay. And lift the right again. Good. And the left. How was that?
That was a lot better.
Yeah. Okay. And come on up. We're gonna have you do a little traction as well, and then you should be good to go. So give it a week. If it's bothering you or it's not quite right, come back in. If it's good, let's just check you. Probably go back to 2 months.
Okay.